Targ's activities yesterday, phone call with Blinken. Was that it?
Yeah.
I got confused. Thank you, John. Yes, indeed, she had a number of meetings in New York yesterday. We have shared with all of you what we have last night in terms of readout of that in our lines, and I have no further to that.
Oops. Okay, thanks very much, Jens. Okay, back to you, Nick.
Yeah, great. Sorry, I've had a bit of laptop trouble today. But yeah, Lisa got part of my question right. I just wanted to check with you, Jens. You said 64% of the 2023 appeal was funded, and I just wanted to check what the number was, how much was requested and how much was received. Thanks.
Yes, thanks, Nick. So for 2023, 64% funded out of requirements of exactly $3.95 billion US dollars.
Okay, thanks again for the clarification. Christian of DPA.
Yes, sorry, Jens. I also need to clarify on these numbers because it gets very tricky. These 3.95 that you just mentioned, does that compare to 3.1? Or do we have to add the 1 billion there? And if it does, are you saying that the humanitarian response plan is smaller than it was last year for 2024? Thank you.
Yes, thank you, Christian. Yes, the 3.9 for 2023 compares to the 3.1 for 2024. So it is a, excuse me, it is a slightly smaller appeal. When we launched the GHO, I think we gave quite an elaborate explanation for why that is happening, not only in Ukraine, but across the appeals. A much more stringent methodology is being used to really focus on those most urgently in need across the world. So given that we, for a number of years, have seen this growing gap between the requirements and the funding coming in, we from the humanitarian community have really done our level best to be as focused as we possibly could be, really doing our side of the job before we went out this year and presented these plans to the donors.
Great, thanks very much, Jens. One additional question from John. Go ahead, John Zarakostas.
Yes, it's a clarification actually to Jens. What I was asking was the U.S. Secretary of State, Anthony Blinken, had a phone call with the new humanitarian coordinator on the OPT yesterday, and I was wondering if there's any development overnight following that call, given that she's had problems of access like her predecessor.
Right. Thank you, John. I at this point in time, I do not have any further updates or developments since last night.
Okay, thanks, Jens. Of course, if there are any updates on that, we'll certainly inform you all. Right. Okay. I don't see any other hands, so now I could thank you both very much for joining us, and good luck with the meeting on Monday the 15th. Before we turn to Dr. Pieperkorn, I think there was a question from John about a special session on OPT, which is our next subject. I believe we have Matt Brown on the call from the Human Rights Council. Welcome back, Matt. Nice to have you joining us.
Hi,
I don't know if
Year.
there's any Happy New Year to you. If there's any update on that particular subject.
No, I can answer, John, that I've heard nothing about a special session planned, but as you know, member states can organize a special session at any time, but there isn't one in the works on that, as far as I know. But also the council addresses matters of Gaza, Israel, OPT in many ways, and just keep your eyes open for what we're planning on that for the next session.
Great, thanks very much, Matt. Of course, we'll make sure to communicate any movement from the council through Matt and colleagues at the council. Very good. Okay, on this note, maybe we'll have to come back to you, Matt, a bit later
Yeah.
for your update, but let's turn quickly to Dr. Rick Pieperkorn, who you all well know, WHO's representative for the occupied Palestinian territory, who's joining us from Jerusalem. And joining him is Sean Casey, who you also know well, WHO's emergency medical teams coordinator, who is joining us from Gaza. We'll start maybe with Rick, and then over to you, Sean. Rick, go ahead. And Happy New Year to you both.
Thank you very much, Rolando, and then Happy New Year to all of you, and greetings from Jerusalem. I was in Gaza a couple of weeks ago, and Sean is there currently, including with another colleague, Dr. Ali Saparmakov. Let me give you some general key issues from Gaza, and then Sean will focus on some more specifics and more recent visits from him to the hospitals, specifically in the middle area. So first, based on the latest figures from the Ministry of Health, so we're currently talking about more than 23,000 fatalities, of which 70% women and children. So that is actually 1%. You talked about 1% of the population in Gaza. We also talk about almost 59,000 people injured, which is close to 2.7% of the total population. So then you're talking about 3.5% of a population very much affected, directly affected. I want to say also something about the injured, because having been there and moving around, and Sean will probably be even more specific on this as well. You talk about multiple trauma cases and patients with multiple trauma and spinal trauma, crush injuries, severe burns, amputees. I've never seen so many amputees in my life, including among children, which, if you think about it, not only the patients themselves, but the family and their communities, this will have such a long-term impacts for everything. I mean, I just want to raise that. A couple of other things, I think, where concerns we want to raise. First of all, the shrinking humanitarian space and the lack of access. And we're not just talking about humanitarian supplies into Gaza, but also the humanitarian aid and the workers within Gaza, so that the aid can be delivered to the people in need wherever they are, in the north, in the middle, or in the south area. And if there is, as long as there's no ceasefire, humanitarian corridors are required within Gaza to make sure that this can happen. And more recently, we've seen the hostilities and the evacuation orders in the neighborhoods of what we call the middle area, what's called the middle area, in Khan Yunis, and affecting access to hospitals for looking now again at health, patients and ambulances, and making it incredibly complex for WHO to reach those hospitals to provide supplies and fuel. And the three most important referral hospitals in the middle and south area are the European Gaza Hospital, and Nasser Medical Complex, and Al-Aqsa. And they are all near evacuation zones. And these three hospitals are the lifeline for the south, which is currently hosting 2 million people. So what we actually see that a constricted flow of supplies and access, but also very important, an evacuation of medical staff from the many hospitals due to fears of safety, they and their family leave. It's a recipe of further disaster and makes the hospital more non-functional. So they become from functional, partly functional, barely functional. And that we witness this in the north, and we want to appeal again, also to the international community. This must not be allowed to happen. So we have not, as WHO, not been able to reach the north for 2 weeks. Sean will refer to that more specifically. Actually, since 26 December, we have cancelled almost 6 planned missions. And our team is ready to deliver. We've not been able to receive the necessary permissions to proceed safely, and it impedes the ability to support and sustain the alien hospital. Now, the intensifying hostility is also hindering the operations in the south and to move staff and supplies quickly and safely. And because every mission now, any moves across Gaza, including the south, needs to be deconflicted, which leads to delays. So if you actually summarize it from and look at the systems, health systems on his knees and a functionality. You talk about 15 hospitals which are partially functional, 9 in the south and 6 in the north, of which 2 barely. And you talk about 3 field hospitals which are functional, and from the primary healthcare centers, only 19 from the 72 are partly functional, and that's all in the south. Another huge concern for WHO is the detainment of health workers. We have actually registered now that there's approximately 66 health workers who remain detained. Often that their organizations, Ministry of Health, but also PRCS, that they don't have any information of their whereabouts nor their families. Last 2 points I want to raise is the medical referrals. We have struggled with this medical referral, and I would say medical referral into Egypt. There's some good news. We know that Egypt and many other countries in the region and outside the region, they have offered support to receive these critical patients. But it is not working, it's ad hoc, and we hope that this can really progressively improve over the coming weeks. On the displacement, we've said a lot, and maybe we'll get some questions about that. 1.9 million people displaced, and also a lot of people severely food insecure, water and sanitary conditions completely below par, an increase in infectious diseases, etc. My last point I want to make, and we shouldn't only talk about humanitarian support. We should also talk about the private sector, which needs to get going again in Gaza. A private sector is always the lifeline, and we cannot have it that the Gaza populations will be dependent on just humanitarian support. That's all from me. Thank you very much.
There we go. Thanks very much, Rick. And maybe just before we turn to Sean, just a note in terms of putting things more in perspective, the 1.9 million people displaced you just heard, according to UNRWA, that's 85% of the total population, a staggering 85% of the population, and 1.4 million of them are sheltering in 155 UNRWA facilities, which of course are exceeding their intended capacity. Sean, over to you, and thanks.
Thanks very much. To echo a bit what Rick has already said, I mean, we're seeing humanitarian catastrophe unfold before our eyes here across the Gaza Strip. It's not just that there's 85% of the population that has been displaced. Many of them have been displaced multiple times. Here in Rafah, where I am, there's shelters, spontaneous shelters everywhere. People are sleeping under tarpaulins, under makeshift tents, in very crowded shelters. And at the same time, we're seeing this humanitarian catastrophe unfold before our eyes. We're seeing the health system collapse at a very rapid pace. Hospitals closing, patients lacking access to health facilities, health workers being forced to flee, as Rick alluded to. And I've been here for the last 5 weeks, go to hospitals frequently. And just 2 days ago, I was at Al-Aqsa Hospital in the middle area. When I arrived there, the hospital director told us that just in the 3 or 4 days before our arrival, he had lost 70% of his staff. They had fled with their families because they were afraid. There were evacuation orders in the area, intensification of hostilities in the area. Just that evening, there was an intensification around the hospital in hostilities, and hundreds of patients, those who were well enough to flee or who had caregivers who could help them to leave, left and fled south. And many of the staff also left. So what's left, actually, it was already a skeleton staff at that hospital. When I visited and walked through the emergency department, I saw once again, as I've seen in hospitals across Gaza over the last 5 weeks, patients being cared for on the floor. Actually, when I was there on Sunday, it was mostly children with gunshot wounds, with shrapnel injuries, children who had been playing in the streets when the building next to them exploded, and waiting, in some cases, an hour or more just to be initially seen, with serious injuries, bleeding on the floor, just a handful of doctors and nurses and volunteers there to care for them. And then that was before many of these staff, these health workers, were forced to flee. The same day I visited Nasser Medical Complex, which is one of the few remaining trauma centers, major hospitals in the southern part of the Gaza Strip, in Khan Yunis. When we visited there, about 70% of the staff were also gone. They had fled farther south to Rafah, where almost everybody is now sheltering, fleeing for safety. I visited the burn unit, where they have over 100 patients with one doctor. I visited the intensive care unit with 40 patients, 3 doctors and 12 nurses working 24-hour shifts. And what we continue to see is the health system suffering, health workers unable to go to their workplace to care for patients because they fear for their lives, they fear for their safety. Patients who fear, and their families who fear going to the hospital because they may die on the way. And actually, we heard that this morning because of hostilities around a hospital in Khan Yunis Governorate, that patients and their families are risking their lives to just seek care. And so these numbers that Rick presented, the 22,000 plus who have been killed, the 58,000 who were injured, many of them are treatable if they have access to care. They have injuries that are treatable. They have limbs that unfortunately are being amputated because they don't have access to surgery, because the health workers have been forced to flee, because the hospitals have been forced to close, because they don't have safe transport to reach health facilities. So we're seeing a dramatic interruption in health services, a dramatic loss of access to healthcare, health workers, of which there are many in Gaza. Gaza has no shortage of healthcare workers, but they are victims of this situation and have been forced to flee themselves. And as a consequence of that, patients can't go to hospitals, they can't seek the care that they need. There's hundreds or thousands of patients awaiting surgery. And it continues to be a shrinking humanitarian space and a shrinking of the access to health services across the Gaza Strip. The last thing I'll say is we're seeing this huge push of people to the south. So people continue to flee to the south. Every evening when I drive home from the Joint Humanitarian Operations Center where I am today, I drive past buses and vans that are chock full of people, just filled to the brim with people and their belongings, fleeing for their safety, mattresses on top of their vans. This place is becoming incredibly crowded. And it's so crowded, you can barely move around in Rafah anymore. It takes hours to go a few kilometers. And these are people who now lack access to primary healthcare, as Rick was saying, but there is no tertiary hospital close by that's accessible. There is no capacity in Rafah. Rafah was a town of 270 or 280,000 people just a few weeks ago, and it now has 1 million plus people. And the key hospitals are in evacuation zones or close to evacuation zones. And so people have no way to access those hospitals and to access care. So it's a dramatic situation in terms of the living conditions that people are in, the overcrowding, the lack of water and sanitation, the high risk of outbreaks. And we're seeing that with dramatic increases in diarrheal disease, upper respiratory infections, and other kinds of infections that are related to the water, sanitation, and living conditions, but also lack of access to treatment for those diseases, which could normally easily be treated, and injuries which could normally be cared for in the hospitals across Gaza, which are now inaccessible. I'll stop there and happy to take questions. Thank you.
Okay, there we go. Thanks very much, Sean. Indeed, that's a very, very dramatic situation. And I just take note that Christian of WHO has shared some additional notes in the chat, which we'll make sure to include in the summary of this briefing. Lots of hands up. I'll start with Emma of Reuters. Go ahead, Emma.
Good morning. One question for Dr. Peeperkorn and one for Sean Casey, please. How much of a risk, Dr. Peeperkorn, is it that the 3 hospitals around Khan Yunis collapse given the hostilities, and what would be the significance of their closure? I'm talking about Al-Aqsa, Nasser, and Gaza European. And Sean Casey, please, could you comment on the hunger crisis? What signs are you seeing of this? And is there a link with the types of diseases that you're seeing in hospitals? I'm thinking about wasting, jaundice, other diseases. Is there a link? Thank you.
Rick, go ahead, and then we'll go to you, Sean. Go ahead.
Yeah, thank you very much. Let me take it first, and I'm sure Sean will like to add. And I just want to mention, like, I was in Gaza, let's say 3 weeks ago for a number of weeks. And so I visited all those hospitals in the south and a few in the north. And in the north, what's happened in the north, and we described it then, like that hospital becomes from functional, partly functional, barely functional to non-functional. That's, I think, is what we fear now, what's happening in the middle and the south area. And I remember that when I visited Al-Aqsa Hospital, which Sean was just describing, that was actually one of the better functional hospitals when I was there. It was crowded, that's 3 times the capacity of patients, normally 200 beds, more than 600 beds. It's crowded with IDPs within the hospital grounds and outside. But it's still and the emergency department was also overwhelmed and crowded, but it was still functional, and it had a functional ICU, etc. And within a couple of weeks, what Sean described, I mean, very well. I mean, like, it becomes from partly functional, like almost like barely functional, where it is now, with not only staff moving out because of evacuation orders, an overload of patients, the lack of specific supplies, etc., and actually overall the insecurity. And that's, of course, how this hospital changed. Now, the question is, what would that mean? So we've seen what it meant in the north. Now, we're talking now about 2 million people in the middle and the southern area, approximately, and 300,000 to 400,000 still north of Wadi Gaza. Now, in the south, we talked about 9 hospitals partly functional. The 3 most important one is Nasser Medical Complex, by far the most important European Gaza, and Al-Aqsa. They are what we say 3rd level referral hospitals. They have a lot of specializations. Now that is already reduced. So we had, before this crisis in Gaza, there were 3,500 hospital beds. Then every time we reduced 2,000, 2,500, 2,000, we came to 1,500. And I think we should make a new assessment now. It's actually less now, probably in 1,400. What we look, when we look at the injuries and the type of injuries, we would actually need 5,000 beds, which we don't have. We're trying to expand that with emergency medical teams located to these hospitals, etc. But that, of course, all depends on the security around that. And you have seen the announcement from MSF and from MAP UK, who were both EMTs in Al-Aqsa Hospital, and they had to really, and they did fantastic work. They did fantastic work with a lot of interaction with them, and they had to withdraw their staff, their medical specialists, their international and national staff withdrew the staff because of the insecurity levels of insecurities. So we just say this should not happen. It should not happen, and the international community should also raise it much more stronger. We cannot afford to lose any hospital, health facility, or hospital bed. Now, on the number of diseases, etc., I think it's complex. I want to make that also that point. It's I think Roland also described a little bit the UNRWA facilities, the overcrowded UNRWA facilities, the multiple makeshift shelters everywhere, and the displacement, etc. So UNRWA and together with WHO, we try to assess the number of infectious diseases. So the latest figures, we talk about 200,000 respiratory infections, 30,000 scabies, and almost 40,000 lice, and 43,000 skin rashes, 7,000 cases of jaundice, which is all with a syndromic diagnostic. So we got testing kits in now, but we don't know if this is hepatitis A or a more dangerous hepatitis E. What's really concerning, we see more than 81,000 cases of diarrhea, and normally the average is like 2,000 cases and per month. So we see a 20-fold increase per month of diarrheal diseases. Well, that's, of course, is series, should we call it an outbreak? I don't know. We need more information actually on this and more follow-up. Maybe Sean, you want to add something on this?
Thanks, Rick. Yeah, I'll just add two things. One on the protection of health facilities. Actually, when I met with the director of Al-Aqsa Hospital on Sunday, despite having lost a huge number of the staff, despite all the hardships and the fear of the intensification of hostilities right down the road, his one request was, please protect our hospital. He said, we want you to come more often. We want you to be here. We want the international community to take action to make sure that this hospital and the other hospitals that are still functioning can continue to function. And that evening, his staff and patients fled because of hostilities and because of fear. So what we're seeing is really worrying around Al-Aqsa Hospital and intensification of hostilities very close to European Gaza Hospital and very close to Nasser. We cannot lose these health facilities. They absolutely must be protected. This is the last line of secondary, tertiary healthcare that Gaza has. From the north to the south, it's been dropping, hospital after hospital. Some of them have gradually reopened, but the single strongest request that I've heard from any hospital director was protect our health facility. And you know, they said, actually, can you do it? Can you protect us? And I said, we can't. We can ask for protection. We can tell the international community that this health facility needs to be protected, but that's the responsibility of the international community and the parties to this conflict. On the question of hunger in particular, here in Rafah, the food situation has improved slightly. Food distributions have occurred, small markets have popped up. People don't have a lot of money to buy food, and a lot of those rations are for a number of days and will need to continue for people to be able to eat. But areas farther north, because we have had so many constraints to access, food deliveries have not been possible. In the north, there has not been food deliveries. There have been very limited food deliveries, and everybody we talk to says that they're hungry, that they need food. The extent to which that can be linked to specific deaths related to starvation or levels of acute malnutrition, we're not in a position to say right now, because we have, in some cases, no communication with hospitals. We have no communication with entire areas. So we can't say specifically that you know, people are dying of hunger, but it's indicative when I go to a hospital and see a patient who's just had a double amputation and they ask me for food or they ask me for water, that they're not getting their basic needs met and their caregivers aren't. And those are the people who need it the most. So the small amounts of food that are getting in are not reaching the people who need it the most. And I think we are very close to seeing a severe food insecurity situation, and hunger situation that can contribute. It's all linked, right? It's linked with the lack of safe water. It's linked with the poor living conditions, that all of this contributes to the spread of infectious diseases and contributes to morbidity and mortality related to these diseases, which should otherwise be preventable or treatable. Over.
Thanks, both of you. We'll take a question now from Imogen Fuchs of the BBC. Imogen, over to you.
Hi, thanks for taking my question. Given what you've said about the insecurity and so on around hospitals, we have heard that the conflict is supposed to be becoming more targeted. Have you seen any evidence of that?
I can take that one, Rick. I've been in Gaza for 5 weeks. I have not seen a lowering of the intensity of the conflict. You know, just as I was saying earlier, I went to Nasser Medical Complex just a few days ago and saw multiple explosions just in the few minutes that I was driving down the road. And we hear about the health workers who are fleeing have been in an area of war for 90 days, and they haven't fled, and now they're fleeing. So they're, you know, these are not people who are fleeing because they hear a couple of gunshots down the road. They're fleeing because they're really afraid for their lives. So I have not seen a lowering of the intensification, and we're still seeing, you know, the indicators that we have, which are from hospitals, is that the patients continue to come. Every time I'm in a hospital over the last few weeks, the emergency departments are still seeing a steady stream of trauma among children who are playing in the street, among people who are in their homes. So from our side, it's difficult to see that. We are still seeing, and I can say this with certainty, is a huge number of casualties and a huge number of casualties related to hostilities. So shrapnel injuries, gunshot wounds, crush injuries from buildings that have collapsed. That's still happening every single day.
Great. Thanks very much, Sean. Nick, New York Times.
Yeah, good morning. My understanding is that there were around 600 patients in Al-Aqsa Hospital. What information do you have on what has happened to them since the instruction came to kind of evacuate that area? I wonder also if you have an update on the number of medical personnel who you have lost, who have been killed in the conflict so far. And thirdly, one last question. I mean, we've had an endless deluge of terrible detail about what's going on in Gaza over recent weeks. I think it was December the 23rd, there was a Security Council resolution that was supposed to improve humanitarian supplies to the Strip. Since December 23rd, or since that resolution, how would you assess what has happened in Gaza? I mean, has the deterioration accelerated since that resolution? Thank you.
Rick, do you want to start?
Yeah, I mean, there's a couple of things. First, I think I want to add to what Sean said in his former question, and you know, some people might argue that the rate of fatalities and casualties has slightly decreased. It's still enormous. I mean, I just want to make that point, and what Sean also mentioned, and sometimes literally in areas which are civilian areas, which they witness themselves. I mean, like moving around Gaza. The question on where these patients went, what we get from the hospital director, that from the most of the 600 patients who left the hospital, they moved to Nasser Medical Complex and Al Najjar. So Nasser Medical Complex in Khan Yunis and Al Najjar in Rafah. And currently, what we get is the latest, like there's 145 patients and 122 medical staff present at the hospital out of a total of 260. So that's actually is the reflection. We don't have the, let's say you asked about the details, I think, on the health worker killed. We are unable actually to disaggregate that number of health workers killed. And on your last question, I mean, I think it's more for I'll say for the people, the team in Gaza, etc. So since the resolution, I think I described already, I think in the start, that for us, it's what we witness is a complex and shrinking humanitarian space because of also the hostilities moving south and the lack of access. And we mentioned that since 26 December, WHO itself forced to cancel 6 planned missions to the north. And those were with medical supplies and equipment and fuel, etc. And why is it important to also have there? And I think everybody agreed that there needs to be at least a number of hospitals, and we're focusing at 4 to 6, to remain them operational, including, for example, Shifa, that Shifa becomes again at least a functional first level referral hospital. I mean, like that, starting they, based on the latest information, they get 1 operation theater running again. So you want to make sure that this is supported and this is sustained, and this we help to expand that. And there's a number of other hospitals. And what for me is maybe the most it's not don't have the right word for it, not interesting, but what is incredible, that situation changes so quickly. I mean, when I visit some of this, for example, this Al-Ahli hospital in the north, it was functional. 2 weeks later, it was actually not functional anymore. There was only some junior staff. And a week later, there's again some medical specialist back, and it is still what we call barely / partly functional. So it's constantly changing. What we should help to do that at least a number of those hospitals are working in the northern areas, and in the southern area, in the southern and middle area, that we don't lose any of them. And what we have seen up till this since that resolution, we unfortunately didn't see much of an improvement, at least not in the health area. Maybe I really want to praise also here the health workers in Gaza, this incredible resilience. I mean, like people moving back and are willing to move back to the hospitals in the north, and even talking, can we facilitate that? And the same what Sean said, we work very closely with the director and the team in Al-Aqsa. They were part of WHO in the past trainings, etc. And that he actually reaches out and tells, please, WHO, continue to visit us, bring the supplies. They said, we need this kind of protection. And we need these emergency medical teams to assist us in this hospitals. And they are not planning to leave. They're planning to stay and serve. And I think we should really take note of that. Maybe Sean, you want to add something on this?
Just 2 brief points. One is, I think it's important to highlight those 600 patients who left Al-Aqsa. They went to other hospitals that are already bursting at the seams. So, you know, they moved to Nasser, which has a very limited staff left and was already very full, way over capacity, and to Al-Najjar Hospital, which is a small hospital here in Rafah. That's not a large referral facility, and it's now bursting at the seams. So they're moving from one bad situation to another. There's no good place to go in Gaza now. There's no hospital that you can go to and expect to get care with certainty. And the other thing that I'll say is just related to the Security Council resolution. I have not, basically, as Rick said, we've seen humanitarian access shrink. It has not gotten better. It has gotten more limited. There are fewer places that we can go. If we can't go to hospitals, the health workers and the patients definitely can't. And you know, we're seeing, as Rick said, we plan missions almost every day to go to the middle area and to the north, and we continuously struggle to get those missions cleared. And that has a huge consequence. It means that hospitals don't have fuel. It means that patients don't have food. It means that there aren't supplies to care for the patients. And so that's 2 weeks of not being able to move to some of these most desperate hospitals in the north. And we continue to supply the south, but as I've said, the few hospitals that are remaining are really bursting. They're bursting with patients, they're bursting with IDPs, and the health workers are barely keeping up. They really are heroes, not only for their bravery, but they're working triple shifts. They're dealing with many more patients than they should ever have to see, and jumping from one critical trauma to another, and just barely trying to keep pace. But they're doing incredible work under the most difficult circumstances.
Absolutely, ditto. Amazing work they're doing. They are indeed heroes. Hard to imagine the situation there. John Zarakostas and then Nina Larson. John, go ahead.
Yes, good morning. Thank you for the update. Question to Rick and also one to Sean. Rick, what's the latest in the emergency appeal, just the WHO appeal for funds for the situation in the OPT, especially Gaza? How much are you funded? And secondly, Sean, you mentioned because of the lack of surgeons, many limbs of children are not saved. And how many children are losing their limbs in excess because of the lack of surgeons? And how many surgeons would you need? And if you have the number, about a month ago, I think UNICEF told us there were just over 1,000 children that had lost their limbs. I was wondering what the situation is today. Thank you.
Who wants to take that? Who's
Rick, you
appointed?
on the appeal?
Go ahead, Rick.
Let me start the first question from John on the plans and on the funding. So thanks for the question, John, because I think we sometimes forget that, you know, we make a lot of comments and analysis, etc. But finally, it's all about being operational and being able to support the humanitarian operation. So you remember there was a flash appeal from the one UN and all partners. That was 1.2 billion. That was for 90 days. Then for health, that was narrowed down, WHO leading coordinating health for 212 million. And then WHO was asked by partners also to have, what can you specifically do, WHO? And so we came to a plan with from October till January, till the end of this month, with a total budget of 110 million. And of that, we secured 49.5 million with an additional potentially 40 million in pledged funds. So we still, I want to say, we've a huge, and the focus of that plan was restoring and strengthening the health sector underneath, including primary care, secondary care, referral pathways, position the emerging medical teams, as Sean was referring at, and a few complementary field hospitals. And the second component was, of course, public health surveillance, early warning, disease prevention and control, everything underpinned with a sustained supply line of supplies and logistics support and the coordination activity. So we still very much in need for flexible funding. What now WHO is we are redoing an appeal for 2024 because we are still, of course, in an emergency humanitarian situation as long as the war is ongoing. And I think that appeal will be at least, even only for WHO, in the areas of 200 million plus. I mean, like we are actually making the plans currently, and we will have to update our operational plan, which will end by the end of this month. So that's over to Sean for the other question.
Thanks, John, for the question. So on the amputations, I mean, I don't have a figure to give you. UNICEF and Save the Children have published some estimates, but actually what's really important about this is not necessarily the figure, but the story behind it. So these amputations are happening, one, because of delayed access to care. So it takes people a long time to get to the hospital if they get there. When they reach the hospital, there's delayed care because there's so few providers and there are so many casualties that the health workers are focusing on damage control and life-saving work. So they are triaging, they're trying to save a lot of lives at the same time and struggling to do that. And then limb-saving surgery, there is a lack of surgeons. There's also a lack of operating theater space. Doing surgery to save limbs takes time. It requires a vascular surgeon, orthopedic surgeon in some cases, multiple specialists. And it takes an operating theater for hours. And so these hospitals are actually focused on saving as many lives as they can. And so their initial focus is damage control, which is keeping people alive, doing initial surgeries. And then if they have an opportunity to do follow-on surgery later, they do that. But we've heard about many cases where amputations are happening, not just because there is a surgeon missing, but because there isn't adequate operating theater space, because there isn't the specific specialists that they need who are available at that time, and because they just have such an overflow of patients awaiting surgery, they can't keep up. So even at Al-Aqsa, when I visited on Christmas Day, on December 25th, they had 120 patients awaiting surgery. And that's when Doctors Without Borders was still there. That's when most of the staff were still there. So this is happening. It's not just a story about the injuries, but it's about the health system's ability to keep pace with these injuries and the complexity of saving limbs. And the focus is on saving lives. We would love to be able to save lives and save limbs, but with these very limited resources, doctors and nurses are having to make impossible choices and focus on saving as many lives as they can with the limited resources that they have.
Thanks very much, both of you. Actually, Rick, you wanted to add something on that point before we go to you, Nina. Go ahead, Rick.
Yeah, I think WHO also shared an audio of a doctor in, I think it was Al-Ada Hospital. And he was making the same point what Sean was making, that they're doing at the moment a lot of what we call above the knee amputations instead of under the knee amputations, because patients come too late, they don't have the right equipment, etc. And that has also, by the way, a huge impact on the patients when amputation, anyhow, is of course horrific and shouldn't be there, but an under the knee amputation and for prosthetics and for the, let's say, for your future life is relatively easier than above knee amputation. So they constantly have to make this kind of choices, what we get back. And when I was at Al-Ahli Hospital, the two medical specialists, fantastic, and an orthopedic surgeon and a general surgeon, they straight away admitted that they missed a vascular surgeon, as what Sean was referring to. So they sometimes had to do amputations, which they said in normal cases they would not amputate. did they have an vascular surgery there? So it's I think it's and it's amputation also. I think it requires a whole system and not just supplies. I mean, like you also think about the physiotherapy, rehabilitation, the nursing care, and everything along, nutrition, food, mental health, etc. So WHO is actually supporting the limb reconstruction unit for over a decade now. I mean, like it's part of National Medical Complex. I mean, like that should we should continue to support that and make sure that, unfortunately for the future, they will have a massive amount of work. Over to you.
Okay, thanks very much for adding that very important point to the points, Rick. Nina Larson, AFP, I think this is the last question. Go ahead, Nina.
Yes, thank you for taking my questions. I wanted to ask about the shrinking humanitarian space that you both mentioned. Israel has criticized the UN or aid agencies for not moving fast enough and for not doing enough. And I was wondering if you could sort of explain what it is that's contributing to this shrinking humanitarian space. If you see any validity in that criticism, or if you could explain. And then also in Al-Aqsa, I was wondering, or the middle area, I was wondering if you're also seeing people going hungry like you're seeing in the north, if you could say if that's also a problem in the middle or the south. Thank you.
Maybe I would like to suggest that Sean actually starts, because he's been living through this, planning for missions over the last 5-6 weeks he's been there. I mean, and constantly. I want to make one general comment on that after Sean. Sean, maybe you start.
So the shrinking humanitarian space is evident. We see evacuation orders in new areas every couple of days. That means that those are areas that are unsafe, where hostilities are actively underway. We request coordination. We coordinate with the parties to the conflict that we can move safely. And those requests have consistently, for the last few days, been denied. We are constantly trying to reach the areas in greatest need. Every single day we make a plan. Every day we line up our convoy. We wait for clearance and we don't get it. And then we come back and we do it again the next day. So between the real risk, the actual risk of danger to aid workers and teams going into an area of active hostilities, and just the efforts made to coordinate movements that are not agreed to, we have far fewer areas in the Gaza Strip where we can access, where we can deliver supplies, where we can take emergency medical teams. We have them ready to go. We have the supplies here. We have the trucks loaded. We have the people who are ready to go into the hospitals. We cannot move. So it's not for lack of WHO or UN effort to reach a lot of these areas. It's lack of access. Over to you, Rick.
Yeah, so just to add, and I've seen this as well in the past, it would be really it's unfortunate maybe that there are so few journalists, present in Gaza, because you could assess that for yourself. I think would be a real unfair statement. I think not just WHO, but many other parts in the UN, they're planning, I say, every day for actually missions and trip for deliveries. If it is medical supplies or fuel for WHO, for others, foods, water, etc., non-food items, shelter items, etc. And as Sean was saying, they get delayed or not approved or denied, etc., for all kind of reasons. I also want to stress the point that even if there's no ceasefire, you would expect humanitarian corridors to operate. If you see that humanitarian space is shrinking, that at least all parties to the conflict, they work towards humanitarian corridors and to make sure that this humanitarian deliveries can take place in a much more sustained way than what's happening now. It is way too ad hoc. It's too little. It's too late, and specifically in the north, and also because there's no safe space. So for the UN, and I think as was described by Sean and myself, Now, even for what we call the south and the middle area, missions have to be constantly planned and deconflicted everywhere. So everything takes time and everything is complex, and then things get delayed and denied, etc., etc. So it's an and among all of that, of course, there's of course also concerns about law and order among the population. Sean described it. Good to hear that now it seems that food a little bit better in the situation, a little bit better in the south, but especially going to the middle and the northern area. That's of course also a very complex phenomena. But I think I really want to stress the UN, including WHO and partners, they're completely ready for this humanitarian transports everywhere in Gaza. It needs to be facilitated, it needs to be happening, etc. But they are very, very much ready. Over to you.
Thanks very much for adding that incredibly important point, Rick, and to you, Sean, for your comments. Of course, this is what the Secretary General has been echoing from day one. Maybe just to say that, of course, thank you again for painting this. Oh, Nina, I'm sorry, before I make a comment. Nina, you have a follow-up. Go ahead.
Yes, thank you. I just wanted to, on the second part of my question, which was about hunger in the hospitals that you're seeing in the middle and the south, if you could just say a little bit more about what the situation is like there compared to obviously the horrific situation in the north, if it's better in the middle and the south. Thank you.
Thanks. I can take that. Better than horrific is not much better. So the food situation in the north is absolutely horrific. There's almost no food available, and everybody we talk to begs for food and comes to us and asks, where's the food? We bring in medical supplies. People help us get our medical supplies through, but they are constantly telling us that we need to come back with food, and that's not possible for a number of reasons, including coordination and security concerns. In the middle area, we are seeing lack of access to food as well. The food is just there's not enough coming in, and there's not enough to feed the 2 million people who are in the Gaza Strip. And it's there's been distributions in the south, in Rafah, and some commercial activity in the south. But in the middle area, people are still hungry, including patients in the hospital, including the health workers. Because we don't have consistent access, food deliveries to the middle area don't happen. And we work with partners like World Central Kitchen to arrange food delivery specifically for patients and health workers, but they are not able to access these hospitals consistently. And so, yes, there is a hunger situation across the Gaza Strip. Even here in Rafah, when I say that there's some food on the market, that doesn't mean that there's not a huge number of people here who are eating one meal a day or who don't have the money to buy the food that's on the market. So it's a horrific situation across the board, slightly less bad in Rafah, but dramatically bad across the Gaza Strip.
Thanks very much, Sean and Nina, for those questions. I was just going to say, well, firstly, just to ask Christian, there are some comments, and I see that Christian has responded to say that he will be sharing these notes by email in addition to the chat. It's very important we get this information correct. On that note, as you pointed out, Rick, the situation for journalists in Gaza is also very, very difficult. That's why it's supremely important to have both of you reporting to us from the region, to our journalists here, to make sure the message gets out. And thank you again very much for painting this very broad picture, very comprehensive, as dire as it is, as horrific as it is. So thank you once again. And as always, you're welcome back. So on that note, I'd like to end this portion of the briefing. Maybe just to stick on the subject of the OPT, we heard a little bit about the Security Council decision last month. I should note that the General Assembly at 10 a.m. New York time, so that's 4 p.m. our time in about 4.5 hours from now, the GA will hold a debate on the situation as to which a veto was cast during the Security Council's meeting on the 22nd of December. And this is under the title of the situation in the Middle East, including the Palestinian question. So this is taking place 4 p.m. our time in New York. Now, maybe just the few announcements we have. Matt Brown and Zaina Awad are patiently waiting with us. Matt, back to you. I think you have an update on the Human Rights Council. Over to you.
Thank you, Rolando. Yes, this is to announce that tomorrow the Human Rights Council will elect its president for 2024. The meeting will take place in room 20, starting at 10 o'clock. This is unaffected by the closure of the Palais that you may have heard about. And also, of course, it will be webcast for people who may not want to go to the Palais. And we can see from the weather, maybe that's a good option. There are two candidates standing for president of the Human Rights Council from the African group, which holds the presidency of the council this year. These are the permanent representative of Morocco, Ambassador Omar Sniba, and the PR of South Africa, Kolisi Nkosi. The 47 members of the council for 2024 will vote for either of those two candidates in a secret ballot that will take place in the room. And after the votes are counted, a simple majority will determine the winner, and this will be announced in the room during the meeting. And the newly elected president will take office immediately and will possibly speak to the council after the election, and then the meeting will close. So that's 10 o'clock tomorrow morning in room 20 and also on the webcast. I will send a note to this effect to you all shortly. Later in the afternoon, just while we're on the subject, there will be the second meeting, and this is what we call the selection of the troikas, which are panels of three member states who are involved in the UPR process. It's a bit of a technical thing, but it's happening at between 3 and 6 in room 20 tomorrow afternoon. And just to remind you all that the 45th session of the UPR is set to begin on the 22nd of this month. So that's my announcement. Thank you all and hope to see you soon.
Thanks to you, Matt. I don't see any questions. I think it was very, very clear. We'll see you tomorrow in room 20. And again, welcome back.
Thank you.
Okay, now I will mention, well, concerning the closure, I'll mention something maybe at the end, but before that, I'd like to turn now to Zaina Awad, who I thank for your patience, Zaina of the ILO, who has an announcement as well. Over to you, Zaina.
Thank you very much, and no worries. Good morning, everyone. Many of you have probably already received an email about the fact that we are publishing our annual World Employment and Social Outlook Trends 2024, or the WESO report, tomorrow, the 10th of January. This is when we annually go beyond the headlines and look at what the data is telling us about the health of the labor market and what that means for the economy in general. We're also going to be holding a press release at 12 local tomorrow, and we've got embargoed copies of the report and of the press release that are available and ready to be made to be shared with accredited Palais journalists. So if you would like to join us, please drop us a line and let us know. We can share all relevant links with you. Really what the report overall will be revealing is it's going to be looking at the at key numbers that show that the labor markets have recovered since COVID-19, but once we dig deeper, we will see that there are some structural imbalances and structural issues that go to the core of social justice and potentially raise questions about a sustainable global recovery, especially within the context of the many crises, some of my colleagues have already discussed or touched on today. So thank you very much, and do get in touch with us if you would like any further information or links. Thank you very much.
Thanks to you, Zaina, very much, and do stay tuned for that, colleagues. Appreciate that. I don't see any questions If you do have any questions for Sena, please do connect with her. I'm sure she'll be able to provide more details. Before we wrap up, just maybe as alluded to, as this briefing, as you know, is virtual, and the reason being is that we have extended the closure of the building here at the Palais for one additional week. However, it's not totally closed. There are a few activities going on, as indicated by Matt. The Human Rights Council is meeting tomorrow. We also have an event, which is actually a Model UN event. It's a Fair Moon event, the Fair Voltaire Model UN event, which is taking place in room 19 tomorrow at 10 a.m. It's an hour and a half, 10 to 11:30. This is just a note that this is a meeting that was scheduled several months ago, well before their closure was announced. I should also note that there are a host of ambassadors who will be speaking. It's an important event. Our Director General, Tatiana Valovaya, the Director General of the UN office at Geneva, will also address the event at the Open at 10 a.m. tomorrow in room 19. So I just wanted to mention that. I don't have further announcements. So I see a question from Nick, New York Times. Go ahead, Nick.
Yeah, Rolando, thanks. I'm just curious, how much money did the UN expect to save by prolonging this closure by a week? And perhaps you can give us a New Year gift, which is a date that you will commit a week's salary to get us into our new press room. Thank you.
Well, if it was up to me, Nick, you know, I would be happy to wrap it and put a bow on it. But it's not up to me. But I can tell you, in terms of your first part of your question, initially, as we had announced earlier, the original closure, the full closure, took place between the 20th of December to the 7th of January, so last Friday, or until Sunday rather, the day before yesterday. With the idea was that this 19-day closure of most of the Palais was estimated to have saved 133,500 francs, which is about $141,000. And this is primarily from reduced requirements for utilities, et cetera. This is a cost-saving measure. There are budget shortfalls, which we're contending with, high energy prices, which we're contending with. So we're doing everything we can while trying to maintain business continuity. Again, the extension this week is meant to sort of perhaps save a little bit more money, even though there are a few meetings taking place. We are on path to reduce our footprint and to save as much as we can. So I would be happy to provide more details if you wish. Christian.
Yeah, yes, happily a bit more details. Could you tell us what is the reason why there's not enough money? Is that countries not paying their dues? And if so, which ones? Thank you.
Yeah, this is indeed, it's part of a liquidity crisis. It's part of a budget shortfall due to a lack of dues being paid. I think maybe I'd recommend that you contact our colleagues in New York to get the details. They provide updates. A lot of this information is available online, I should point out. It's very public. We're very transparent about regular budget assessment, who's paying up and who's not paying up. But of course, it's a business, you know, it's a very expensive operation that we run here. I should note that of the Geneva is about 2.2% of the UN's regular budget. The UN's regular budget overall is just under 3.4 billion, and about 77 million for the UNOG operational costs. That's about 2.2% of the overall regular budget, just to give you that perspective. But there are some details which I cannot perhaps recite just here. I'd need to dig a little further, but I'd be happy to share this with you if you want to reach out to me afterwards. But indeed, in terms of members who are not paying their full dues, maybe it's best if you contact our colleagues in New York who have their finger more closely on the pulse on that in that regard. Further questions? No, I don't see that's the case. So on that note, I'd like to thank you very much. And again, Happy New Year to all of you. Bonne année. Let's hope for a more peaceful 2024. Have a good afternoon.
Recording stopped.